Thank you so much for joining us today. We are here at the Iowa Wildlife Center, where, as you can see, they're checking in on a snake that was just brought in. But we have with us Marlene Erzman, who's the executive director as well as the founder of the Iowa Wildlife Center. Marlene, tell us how you got going with wildlife that you've been saving for over 40 years.
I've been doing this a really long time, and about in 2007, someone who knew of my involvement on the National Wildlife Rehabilitators Association board and starting a state association and having done hands-on rehabilitation for so many years and education programming, came to me and asked if I would be interested in starting a wildlife rehabilitation facility here in central Iowa. I thought about it long and hard, and because it was a big step for me personally, but for my family, and decided it was an opportunity. It was something I had been wanting to do for a very long time, and so I said yes. And so they gave us a significant contribution, which allowed us to hire our first staff and purchase 75 acres of land that we call Wildway in Boone County, which is about 25 miles west of here, and that's where this facility is going to be located. Wildway is the 75 acres that we were able to buy with that first significant contribution. And that's going to be the heart, that's going to be where the campus is going to be located. And we've already have buildings up there. We have some pre-release enclosures for birds and bats, and we have our storage and maintenance building already erected and full and in use. And now we need to finish things up and get this new medical hospital and education facility designed and built.
Right, so today we've been working in an office downtown and then releasing animals out at Wildway. And so right now we've been interviewing architects next week, looking at a 20,000 square foot building, I believe.
Yeah, so over the decades, one of my co-founders and I have visited many wildlife rehabilitation centers across the country, and many of them are being built to this day. We're going to another one that's hosting the National Symposium in February, so we'll be able to visit that brand new state-of-the-art rehabilitation facility in Washington State. So based on all these conversations and site visits, we're definitely looking at least a 20,000 square foot facility to house our hospital and education units. And we estimate, and again, this is a good estimate, that we'll need at least $18 million to get this all done, and that includes staffing it as well as completing all of the equipment purchases and things.
And we are focused on making this a green facility.
That's right. That's right.
And to date, we've also done a lot of educational events, kind of that go along with kind of the tagline of Wildway.
Yeah, and so our Wildlife Center's tagline is "Healing Wild Lives, Wild Land, and the Human Spirit." And so besides the actual medical treatment of these animals and at Wildway we've been reconstructing and restoring a lot of the native habitat, which is exactly what these wildlife need once they're released. And in the most altered state in the nation, in the heartland of this country, Iowa's desperately needing more quality habitat. And it's an outdoor classroom for the people that visit. So we have large annual family events such as Open Hearts, Open House, and even the more intimate Walk in Beauty, Go in Peace monthly gatherings. And through all of these gatherings on Wildway, we adhere to the premise that everything is connected and everything is divine.
Okay, since you got the 75 acres in the Iowa Wildlife Center, what's the mission? What's your real mission statement?
The mission is to provide professional wildlife rehabilitation to Iowa Native animals, to provide professional conservation education programs to the public, and to provide wildlife assistance skills training to volunteers, other rehabilitators, and state and county agencies.
So right now, you've primarily been using an office in Ames to, such as this room, the exam room.
Yep, this is our exam and treatment room, and you can see that we're really crowded. We can't put lots of animals in here. Tiny bats, like the ones that they're checking in right now, that's about the size of it. And I think behind me we've got a turtle and a snake, and and a goldfinch. So little animals can come in here, and other animals are spread throughout the rest of the office rooms and in hallways and things. So we've definitely outgrown what we're doing, and we need an actual medical facility so we can help save more wildlife.
And so to date, some of the other events that you've done as far as education and kind of incorporating your tagline of the Iowa Wildlife Center, tell us about those.
Well, so the tagline, as we created this and knew what species we were going to take in based on, I'm a wildlife biologist by academic training, and so I have a large network of professionals that can, whatever I don't know, I can turn to other people, both in the state and nationally, and for answers. So the tagline, I decided as we worked through the early years of the Iowa Wildlife Center, was healing wild lives, wildland, and the human spirit. Because it's certainly been true that when people bring us these animals in need of help, you can see the connection that they have to these wild animals, and they're so grateful that we're here taking them in. Now, because we have such a small space in a rented office building, we can't take in all the animals that we are called about. So we've been here now for about 15 years, and so now it's time to grow up and grow out. So that's why we really need this facility soon.
And so after doing all of our research, visiting various places, we think with this 20,000 square foot facility, it's likely to cost close to $18 million. And that's to get it funded, all the machinery in, get it faculty, and get things rolling.
Yes, yeah.
And we hope to get started get it finalized on our architect next week, which is the first week of February. And
we're really excited to be in this phase of this whole project, and we know we've got a lot to do, and we're ready to do it, and we have a really good team behind us with staff and senior volunteers and you and the cameraman and everybody. It takes all of us doing this, and they understand the mission, and they've believed in it and have supported it for a really long time now.
So this is what we can do to help create positive change in this crazy world that we have created, and hope we can heal more lives and more animals and more spirits. And thank you for joining us, and we look forward to working with you to make this dream come true.
Thank you.